Hi, I'm Dr. Tamsin Cockayne from NT PHN. This is a short video to introduce you to NT HealthPathways. NT HealthPathways is an online health information portal that allows GPs, nurses and allied health professionals to see the agreed pathways of care for Northern Territory patients. HealthPathways is particularly useful to GPs as it helps them understand the agreed pathways that tertiary and primary care clinicians have thought are the best way to refer our patients in the Northern Territory. There's currently 200 pathways live, and these will be growing over the next few years as we work together to best articulate how to look after our patients. Now I'll take you on a step-by-step guide as to how to log in and use NT HealthPathways. Head to the NT HealthPathways site to access the login page. Insert the login details that are relevant to your region and profession. These are available from your practice manager or by contacting us via email or telephone. You may want to save this page to your favourites or download the icon to your desktop. Once you've successfully logged in, you'll be redirected to the home page. This page contains important local health system news such as public health alerts, new clinical services and educational events. At the top right, there are some useful buttons that link to external websites, such as the MBS Online Health Provider Portal and the Remote Primary Healthcare Manuals, also known as the CARPA Manuals. These will be updated as we bring more directories online. On the left-hand side is the main navigation pane. Click on the plus and minus buttons to expand and collapse the menus under each heading. Clicking on the headings or the subheadings will open the relevant pathway, and you can still use the left-hand pane to navigate back at any time. Headings and subheadings in light grey font contain pathways that have not yet been localised for the NT. Non-localised pages contain the information from the founding Health Pathways site in Canterbury, New Zealand. These pages still contain useful information, but remember that they've not yet been adapted for the Northern Territory. Another way to find information is to use the search box. Let's say you're with a patient who's presented with new onset atrial fibrillation. You think they may need investigation or may even need to see a cardiologist. You search for atrial fibrillation and click on the link to the relevant pathway. Each pathway generally follows the same format, with red flags, which are important things to consider, assessment, management, and requests, which contains the referral information. The information is deliberately condensed into drop-down boxes to allow quick navigation to the information you need. You can expand and collapse relevant sections of the page using the plus and minus buttons. Uniquely in NT HealthPathways, we've also linked all pathways to the Remote Primary Healthcare Manuals, the CARPA Manuals, where there's an existing one already. We also have links to e-therapeutic guidelines, so if you click through on the medications, it will take you directly to ETG. In this example, you think the patient needs to be assessed by a cardiologist, so we click Non-Acute Cardiology Assessment. In HealthPathways language, an acute assessment occurs within 24 hours, and a non-acute assessment is anything greater than this time frame. This takes you to the non-acute cardiology assessment page for referral options for the public and private systems. Here you'll find the referral criteria for each condition seen in the cardiology department. It allows GPs to understand how their referrals are triaged into category 1, 2 or 3. Importantly, it also contains required information for referrals to the public service. You will find essential information which must be included for a GP referral to be accepted and additional information that will assist in the triage process. This page also tells you how to send a referral with links to the relevant referral templates and contact details. At the top right of every page there's a Contact Us button. We really encourage you to use this to give us feedback about the pathways. There may be things that are incorrect, that are out of date, or links that no longer work, and we want to know that so that we can improve it and fix it as quickly as possible. NT HealthPathways is strengthened by all clinicians giving us feedback and helping keep it a relevant and up-to-date tool. Hundreds of GPs across Australia and New Zealand are using HealthPathways. If you'd like to find out more about this service or become involved, please contact the NT HealthPathways team.